And here is a picture of a more complex neural network. This is just a way we wanted to visualize what we call a digital fabric. I like the term fabric because this is the picture that comes to mind. And if you look at each intersection here, it's almost where you can place a node there. And it's this interconnectivity between all of the data around the system being centered around the patient.
Aaron and Alex, thanks for hopping on today's podcast. Excited to spotlight you guys and your work at RRSP Industries. You guys are really doing some innovative work with cyber physical systems, digital fabric across not just healthcare, but other industries like oil and gas. And to get things started, Aaron, can you tell us a little bit about the story of how you and Alex first met and what inspired you guys to both start RRSP Industries?
Yeah, Bert, thank you so much, and thank you so much for inviting us on your podcast. You're doing amazing work, and I think it's important for people to be able to, hear not just the stories of founders, but the impact that they really can have in healthcare. This untold story that most people don't see in terms of the work that gets put in before something hits the front lines, hits the patient on the front lines. So thank you so much for having us here. I met Alex when I was in medical school, but my personal journey in healthcare started probably about a little over 10 years ago when I was working as a paramedic in the emergency medical services. I fell in love with EMS. It was I always knew I wanted to help people. I always knew I wanted to help people on more of a personal, practical level. Went to college after high school because that's what it's what you're told you have to do. In my case, it was apparent that that's not the case. Got involved in EMS as a way to leave school and try to figure out my own career path. Fell in love with it. Worked my way through school to become a paramedic. Fell in love with that, and a lot of people really encouraged me to pursue medical career further. For me, because I have roots in Poland, and it was the cheaper option, and I had to explore the reason why I wanted to be a physician first. For me, the work that I wanted to do as a physician, couldn't require me to take out, $500,000 worth of student loan debt in the US. So, for me, going to Poland, learning Polish, studying medicine in Polish was the most optimal answer. And it just gave me a love for seeing different healthcare systems operate in a different way. It's kind of amazing when physicians are forced to work with less diagnostics or incentivized to not go to diagnostics for treatment first. It really tunes the physical assessment and fine tunes it. And after seeing that, after my experience working as a paramedic and knowing what I could do as a paramedic with the knowledge that I had then, comparing the education of medical school and to be a physician to autonomous decision making, and seeing these factors kind of co-play live for me while reflecting on my own career got me extremely interested in healthcare system design, how providers may get pushed in a certain direction based on pressures of the healthcare system as well, where skills may develop or skills may atrophy as well based on how the healthcare system may push providers. Another thing that I found extremely interesting, and this is where I met Alex in my medical career journey, and we shared a passion for, is seeing there's two main gaps that we saw in the healthcare industry. One, technology was being emerged at that time, was creating more of a gap between the patient and provider. And we thought that technology should be used to actually close that gap, not create a wedge, bring the patient and the physician closer together. And the other gap was with emerging technologies, there was a lack of translating those technologies to real world deployment and impact. And so Alex and I, we saw this problem, kind of fell in love with it, looked at this also as an escape project for medical school, had a lot of passion for engineering and different aspects outside of medicine. When we were being pushed to study, kind of gave birth to RSP Industries. We slowly were discussing it after suturing class on Saturday over burgers, and from there it just became more of a reality. So with that, I'd like to pass the story over to Alex.
Yeah, that's amazing. And Aaron, thanks for sharing your background all the way from going to med school in Poland to having this experience in the EMS space, and then seeing those large two gaps with technology and emerging tech. And now, Alex, I know you also have a background as a physician. You work in the ED department yourself in Zurich, is that right? And I'm curious, If you could share a little bit about the gap that you saw between innovation and clinical practice that pushed you to build, RRSP with Aaron. Tell us a little bit about that.
Yeah, thanks, Bert. Again, a little bit, maybe I'll just start a little bit about me. I'm Alex, I'm Polish by origin, grew up in Germany, met Aaron during my studies in Poland. We kind of really had the same drive of like trying to, find solutions, find problems and find solutions in the healthcare field and, do something outside of like just the regular study space. So we wouldn't get less frustrated about, not passing an exam or doing something else. So that was really what Aaron called as an escape project. It turned out for us to work more to become something bigger, because as I started working in the healthcare field, especially as I first started working in Germany, I worked in the cardiology department, in the ED, came over to Zurich now in Switzerland, also working in the ED here. It became more and more apparent also through our discussion with Aaron that there's a critical gap between like how information is passed in the healthcare field and how that information is translated actually in clinical practice and how it actually affects the final outcome. Because from a system perspective, what I'm doing in the ED whenever I have a patient coming in, let's say it's a walk-in patient or it's a transfer from emergency services, there's certain work that has been done and that I do, right? And my job really as an ED physician is I try to get the information that I need and I analyze it. And based on that analysis, and based on the information that I obtained via my analysis, I take the next step further in the treatment plan. And that's really the trajectory that the patient is taking. And I'm making a decision that influences that trajectory either in one direction or another direction. And that these nodes are everywhere in the healthcare field. So you can really think about this as an integrated network. What we at RSP Industries do is we really started to think about, how can we actually leverage all that work that has been done and actually really center it around the patient and really keep the trajectory to its optimum. Right? Because a lot of times work has been done, but some of it is lost and some of it is not really translated well. So there's always communication gaps. And that's what we just started thinking, what if we can design a system that actually really addresses that problem, right? Where all the work that has been done to the patient actually translates forward and keep the trajectory as optimal as possible. And that's where the cyber physical system comes in. Cyber physical system, that's really an academic term describing an interplay of different systems and networks in the physical space, but also in the cyberspace, but also in the physical space, where you have data information being collected, whether it be through monitoring devices or smartwatches or whatever, that is actually translated in the system. There's analysis done, and there's also an interplay between how you actually exchange that information in the physical space with a provider, with a nurse, with a physician, with the patient, right? And that interplay, that's what we designed our system, RSP Hub.
Yeah. Now that's fascinating. I mean, it's clear like you and Aaron like saw eye to eye, in your studies, in your medical studies, and then translating into your actual career as a physician. You've seen these, as you call them, issues between cyber and the physical space for patients and providers, and that's something that actually stood out to me from your guys' work, is that you guys have your own physical system, or you're designing your own, right? Can you, for the non-as technical folks, can you break down what your cyber physical system is and how it helps manage healthcare networks around the patient? Can you speak to that? Yeah.
Oh, no. Thank you, Bert. That's a great question. And it's an important question because, when Alex and I first started, we didn't know what a cyber physical system was. And we were trying to explain something without having that technical background in a completely different language. And we were really fortunate to come across an expert in that field who really, took Alex and I through, training us how to take what we were describing and actually implementing it, making the technical drawings for a patent during the patent application, and really helped train Alex and I from a technical perspective. And we were very fortunate to come across him and for him to be part of our team with a few other, experts in different domains. So to better explain that, I would like to share short presentation. Can you see my screen?
Yep.
Okay, perfect. So we're familiar with the term digital twin, right? And a digital twin can simply be described as a person interacting with a device, right? Technical device, and the interplay between the two and the interaction. So when Alex was describing the cyber physical system as a relationship between the physical and the cyberspace, now we could think of that in terms of the human to system interaction and the interplay between the two, optimizing the system around the patient, right? Resources, supplies, medical care, and to make sure that you can provide the most optimal care at the proper time for that patient to meet that patient's needs. And in other words, you may hear people say healthcare system resilience, and that's our definition for healthcare system resilience, providing the most optimal care for that patient at that point in time.
Very interesting.
And so here, the fancy term here, you could call it an ontology, right? So Alex was hitting on these terms nodes. So each circle here is a node, right? And a line between them would be a relationship. And so in the center, I have healthcare facility. It could be any type of healthcare facility. It could be a clinic, it could be EMS, it could be a physical rehab, it could be a hospital, it could be an assisted living, it could be skilled nursing rehab, like I mentioned before, right? So any type of system or healthcare setting which is going to deliver patient care. And around them, right, there's scheduling needs that they need to meet. They need to make sure they have enough healthcare professionals. They need to have an electronic medical record to document. They'll have an enterprise resource planning solutions, meeting their logistical needs, medical supplies, and things of that nature, right? There's administrative needs which go in here as well, making sure they're meeting quality care metrics and other key KPIs as well. So here, each need, right, scheduling, administration, supplies, whatever, we create as a node around that facility. Patient, right, is the key to all healthcare delivery. None of these places would exist if the patient didn't exist. So what's important is to meet the patient where they are in time. So around them, you can create those nodes, right? Wherever they're going. Is it the hospital, the clinic? They'll receive care in the home. Is it EMS, right? Responding to a 911 emergency, or if you're in Europe, 112. It could be an assisted living, a nursing home, a rehab, wherever that patient is in time, right? But then if you look at the patient more closely, what needs does that patient need within those nodes, right? They need caregivers. There's differential diagnostics, right? Alex was talking about data, signs and symptoms, diagnostics, medications that are given, supplies. And if you can capture this information in time, then you can start developing a picture around the patient. So we may use the term patient state space. All that means, it's a fancy term which describes that patient in time and all of the information you can grab around that patient in time that matters to receiving optimal care. And here, right, we don't need to be technical. We don't need to be doctors to understand what's on the left. We don't need to be data scientists to understand what's on the right. But if you take the same ontology, right, and you overlap it to a modern day neural network, right, the picture on the right is describing the inputs, right? So, for example, if we put that patient in that center node, what data are we feeding to that patient at that point in time? And now this is an isolated node and what's happening within a much deeper neural network. And if you combine all of them together, just like you have different neurons in your brain connected, you have a neural network. And here is not a neural network, but an example of that ontology that I was describing earlier on a much larger scale. The whole healthcare system, what's around EMS, how EMS is related to hospitals, insurance, care providers and supplies. And I kind of designed it here a little differently. We're in the center, you are stakeholders which align to all care services. And what's interesting here is that EMS, a very underfunded field, is actually the key link between pre-hospital care and in-hospital care delivery. I mean, if you look at the actual, funds of healthcare, I think about a third of it goes to hospitals, but the majority of care actually happens outside of hospitals, right? So that's kind of what I wanted to demonstrate here in the blue versus red. And here is a picture of a more complex neural network, right? So this is just a way we wanted to visualize what we call a digital fabric. And it is, if you take, I like the term fabric because, this is the picture that comes to mind. And if you look at each intersection here, it's almost where you can place a node there. And it's this interconnectivity between all of the data around the system being centered around the patient, where then you can provide real-time measurements of data that can allocate resources, allocate personnel, actually measure patient improvement, through time, share information in a friendly way to each stakeholder who needs to understand that information differently. And that's really important. And where you can have this real-time optimal feedback loop based on patient improvement through time and how that system can help that patient. And you have what we call a digital fabric, right? The interplay between the patient and the system improving to meet the needs of that patient. And that's why we use the term digital fabric to explain the cyber physical system.
Well, that's fascinating. I mean, tell us a little bit more about this, like what this digital fabric is. Like, how would you use digital fabric to connect like system level data? Because you threw out, like, I saw like EMRs was on, like, one of your slides, and I'm sure the EMS space has its own systems. In the hospital, there's its own systems outside the hospital. So, like, how do you use this to connect that system level data with patient level data? Like what are those like nodes like look like in real life when you connect the dots there between the system and the patient?
That's a great question. So we could look at different examples within EMS, but I think to better answer your question slowly, I'll take an example that most people don't think of when they think of healthcare. I think when most people think of healthcare delivery, it's in your home, calling 911 as an emergency, and the ambulance bringing you to the ER, and what happens in the hospital. But like I pointed out, most of the care happens outside of the hospital.
Right.
And what if you're in an area where you don't have access to an ambulance? How can our system help? Right. And so I'll give you an example talking about, patient journey. Let's say you're traveling. Let's say you're in your mid 50s. It doesn't matter, male or female. But let's say you're in your mid 50s and you're traveling, and you have some risk factors for heart disease, but you've never had a heart attack before. So you're concerned, and airline offers a travel insurance policy, one that allows you to link to our system. And what that is it offers the patient peace of mind where they could be safely monitored throughout their vacation. So let's say they had a great vacation. They have an Apple smartwatch because they're in their 50s, and they like to keep track of their steps and keep track of their health, even if they don't have their own remote wearable that would be taken care of in a different way. But let's say they do. It connects to our system. All their health records as well connects to our system. And what our system does is it shows it to the patient in a friendly way and allows them to be connected to their home physician as well throughout their journey. And the home physician can see their information in a friendly way and be alerted of any deviances. So they had a great time on their vacation. They're on their way home, and they're flying home. They're flying across the Atlantic Ocean. They're an hour and a half away from, let's pick Kennedy Airport in New York. And all of a sudden they start having strong chest pains. They get really sweaty, and they get concerned. So the flight attendant can come. Automatically, we see changes with their blood pressure and their heart rate. It was notified to their physician. And there's certain companies which are contracted to these airlines. We would be partnered with them in this signing up for the travel insurance. and all of a sudden the flight attendant comes and they have an iPad which is assigned by this company that they're partnered with. They have color coded medications which can be given in different emergencies, and they do an interview with a telehealth physician that's actually assigned to that company. Now we see a problem, right? Why is a physician who doesn't know this patient in a very isolated area going to help guide the care? Now they can be connected, like I said, was alerted to the patient's home primary care physician, where they can coordinate, these two physicians can coordinate in terms of the best care path. Let's say they're concerned, they're suspecting the patient is having a heart attack. They can automatically notify, these airports are contracted with certain ambulance services. They can notify the ambulance service, send that information to the patient's information to the ambulance service prior to arrival, where they can even send it to the nearest receiving hospital who has cath lab capabilities in that case. And once it's confirmed, the cath lab can be notified and also see the patient's vitals and medical history and other important information before they normally would, to help prepare activation to decrease that time. In healthcare, we call it kind of time to balloon time, but more time to treatment, right? Your heart muscle is muscle. It does not recover. When you're having a heart attack, your muscle is dying. The sooner you can recover blood flow to that muscle, the better for the patient. So we can decrease that time by getting everyone prepared, and also, more importantly, make better care decisions throughout that process for that patient, because they're armed with the patient's history and can collaborate with their primary care, and which really matters when it comes to post discharge and the recovery period, where these decisions are much more important in being made. And I'll let Alex touch on that. But another area I'd like to touch on outside of that example is, through that time, because we can apply learning through the patient time, is you can then start to predict patient cases in different geographical locations, and what those, if you can predict the patient cases, then you can link that to the supplies and the number of personnel you need to those geographical locations, which can help EMS better allocate their resources, and staff shortages, which hospitals can better allocate their resources and staff shortages, because you can apply it really at any point in time through any care service. And that's really our goal. And that's one example where I touched on, outside of contemporary healthcare, that most people don't think of in companies that we're speaking with, and also contemporary healthcare delivery, which most people are already familiar with. So with that, I'll let Alex take over from a physician's point of view.
Yeah, sure. So from my perspective as a provider, let's say, or as well Aaron's perspective, like we at that point, whenever we have a patient coming in, and depending on the complaint that the patient has, there's certain information that we require, right? Most patients, but the basic information are mostly past medical history, medications that have been using, allergies, stuff like that. There's always like a baseline of information that we need.
And the ED, right? You're referring to
the ED. Like I'm gonna stick to the ED for this example. So let's say a patient comes in, and I need to obtain all that information. They're not in a system. They're not here. They're not in our system, or they have not been in our facility before. They're from outside, or maybe they're traveling. They're maybe international, like coming to Zurich for their honeymoon, whatever. There's two things: either they don't know what their past medical history is, or they can only explain it in layman terms. And they know the amount the medications have been taken, but they don't know what it means. They can't even say the names, because, to be frank, the names are sometimes pretty grotesque at some point. So, and most people don't even keep lists on their phone, which is like the easiest thing to do. Just keep a list of things in like your phone. You could just have that ready to go whenever you need. But most people don't even do that. They take pictures, whatever. So as a provider, I'm always concerned about the kind of information that I'm able to get, right? And if I had, let's say if I had a system in the form of an application, let's say, that is on the patient's phone, that, depending on that, does analysis in the back, which Aaron described, has a certain state achieved in the let's say patient state space that is sort of like you could think of it as a digital twin, so a digital representation of what the patient actually feels like in right now. And the system kind of is already preparing to give me information based on what I really need to know in order to make the best decision moving forward, right? Because as a physician, my job is really collecting information and passing it on, doing the analysis and passing it on. And if I have something, and if I can skip the step of actually getting the information, right, that is most basic for my decision making, right, by outsourcing it to this network that is already in the back, and I can just have it and that interacts with my system, let's say in a hospital, I can easily make really great treatment decisions and move the patient forward in its trajectory, and not spending hours trying to contact GPs, trying to contact other facilities, like all of that stuff that would necessarily call up their pharmacies to ask for the medications, like stuff like that. That just goes out the window because I have all the information at hand. So from a provider's perspective, what are we really delivering is giving you the information that you need at this moment that you need in order to make the best treatment decision possible in order to move the patient along in this patient trajectory.
Yeah. No, it's fascinating listening to you both about, like, based on your experiences, Aaron, you with EMS, and Alex with the ED department, like the actual like use cases like of these real life like neural networks, like Aaron, you were describing earlier, that could coexist and support, patients and providers like you guys, right? Like Aaron, your example of predicting patient cases in geographical locations, right, based on a neural network, or Alex, yours on having a digital twin representation of what the patient feels so that you as the physician can get data on them as they are arriving, and both of those don't happen without this like neural network or this digital fabric that's connecting the systems right together and giving you information. It's pretty fascinating. Now, can either of you just comment real quick on like areas where you guys have started to really, invest your time into with these cyber physical systems? I think, we spoke on a couple there, but what, just real quick for the audience, can you throw out some of the areas that you're working on? I think we spoke about like cardiac rehab as one, for example. Do either of you just want to comment on that?
Sure, I can jump in, Bert. What we're describing essentially in high level terms is obviously applicable to a lot of different fields. One of them being rehabilitation. Specifically, we pick cardiac rehabilitation. Rehabilitation really starts at the moment. Let's say you have as Aaron said, a heart attack. You came in, you went to the cath lab, you got your primary intervention, or you went to surgery, you got bypasses. Your rehabilitation starts at that very moment, right? When you're in the hospital, these 5-7 days that you spend there. That's phase one. Then you move on to phase two, which is mostly outpatient, sometimes divided by another facility, rehab facility. That takes a couple of weeks, 3 to 12 weeks. Then followed by phase three, which is usually a more relaxed kind of like, okay, there's still follow-up with a patient in an outpatient setting, but the patient is at home, right? And just recovering by itself. And sometimes you refer to as level of phase four, which is the maintenance stage, sort of that is years along the line they're providing. So what we're really doing with cyber physical system and hub infrastructure that we're providing is to allow patients to initiate their cardiac rehabilitation much earlier as opposed to when you don't have a system like that, right? Because what we see as a problem most likely is that sometimes you get your prime intervention and then you require a secondary facility, but that's not available. So your lack of time, and we've seen that this delay in time, delay to, let's say, proper rehabilitation, actually increases your mortality rate, sometimes up to 30%, 33% at a time. And unfortunately, like these cases like that tend to be like in urbanized areas. People there are facilities centralized, but like even they can't cope with the amount of people requiring cardiac rehabilitation at that very moment. So what we're trying really to do is to bridge the gap of initiating that cardiac rehabilitation using a cyber physical system where you can train people from home, allow them to have people, let's say ambulances and EMS services provide these critical capabilities on site as well, so people can initiate the thing at home, the card rehabilitation at home, while at the same time have monitoring capabilities that are collecting that information that is gathered in the back, done a little bit of analysis, and that is sent back to, let's say, the primary treatment facility or the primary clinic that is still managing that case, that they have an easier time monitoring the improvement of that patient. And if, let's say, if there's an improvement, they can easily schedule an appointment. If there's a decrease in their condition, they can schedule an appointment or send out an ambulance or send out people. Maybe they can schedule to come in a dedicated facility earlier, stuff like that. But we're providing that critical gap. We're providing that critical capability to close that gap in treatment initiation with a system like that.
Yeah, I mean, it's clear listening to both of you that the big value with these like cyber physical systems and building these neural networks is bridging the gap in time and access to care, right? Like Aaron, your example earlier about time to balloon, right? Like you need to reduce that time for a patient's heart that is going through a heart attack, or for your world, Alex, right? It's like ensuring that they have timely access to a facility if they're in cardiac rehab as a follow-up, like that time is critical for their rehab process. So it's very fascinating. Now, just to round things out for the folks listening, and thinking, I'm interested in building a cyber physical system for my own health system, no pun intended, or, the care continuum of the types of patients I see. How can they engage with you and your team online and start to, really prototype something with you or work something out? How do they find you guys online?
That's a great question. Thank you, Bert. So we do have a website. You can always find us on our website at rrspindustries.com. You can email Alex or myself personally. My email is Aaron, aaron.zak@rrspindustries.com. Alex is alex.grzeszka@rrspindustries.com. Alex spelled Alex. Grzeska spelled Grzeska, not to confuse anyone. And we do encourage people to reach out to us to collaborate, because maybe we didn't emphasize this enough, but when we envisioned this, it was never to compete against remote wearables. It was never to compete against different machine learning, AI, optimization, decision support making offerings, but it's how to bring these things together to create a more optimized healthcare system to provide resilience. So we do integrate with third-party wearables. We integrate with third-party AI models as well. And we do integrate with other companies. You can almost think of it as like an operating system for applications. So, for your computer, you need an operating system to run multiple applications. You pick and choose how you use them. Same thing in healthcare, right? We created an operating system around the patient so that the different delivery offerings can be used optimally to support that patient in that period of time.
I love that.
And also piggyback that. Please reach out on our website. You can also find us on LinkedIn. Aaron and I. Links probably will be given in the description below.
Yes.
And just shoot us a message also via mail. Or
100%. I love it. It's like the OS system for your applications. So that's a great way to kind of round it out. So Aaron and Alex, it was a pleasure having you today on the podcast, and excited to follow you two's journey with building these cyber physical systems at RRSP Industries. And it's been a pleasure speaking to you, and we'll definitely be in touch. Thanks for coming on, guys.
Thank you so much for having us today, Bert. It was a real pleasure speaking with you, and we really support what you're doing with HealthTech2Care. So thank you so much for inviting us on.
Much appreciated. Thank you.